Welcome back to the Score Builders Question and Answer podcast. This podcast provides members of the Score Builders team with the opportunity to explore challenging multiple-choice examination questions with students actively preparing for the licensing examination. Ready? Let's go. A patient has been diagnosed with osteoporosis in their spine and their femurs. They have been cleared by their physician for physical therapy and are eager to begin exercising. Which exercise should be avoided in the patient's therapy program? Option 1. Prone press-ups performed through a full range of spinal extension. Option 2. Jogging on a treadmill with a moderate incline. Option 3. Bodyweight squats with the trunk in an upright position. Option 4. Sit-ups performed through a full range of spinal flexion. Osteoporosis is a metabolic bone disease characterized by decreased bone mineral density, resulting in increased fracture risk. Exercise plays a critical role in managing osteoporosis, as mechanical loading on the skeletal system stimulates bone remodeling and can slow or reverse bone loss. Physical therapists must carefully consider the biomechanical demands of each activity when designing a safe and effective exercise program. In osteoporosis of the spine, the vertebral bodies are the most vulnerable structures, and the anterior portion of each vertebral body is particularly at risk. Activities that load the spine in flexion compress the anterior vertebral body, which is already structurally compromised by reduced bone density. So as we evaluate each exercise, the key question to ask is, does this activity place the spine in flexion under load? If the answer is yes, it should raise a red flag. Let's explore each of the options. Option 1. Prone press-ups performed through a full range of spinal extension. Spinal extension exercises are not only safe for patients with osteoporosis, but are often prescribed. They strengthen the spinal extensor muscles, reduce anterior vertebral loading, and help counteract the progressive thoracic kyphosis associated with vertebral compression fractures. This exercise belongs in the program, not out of it. Option 2. Jogging on a treadmill with a moderate incline. Moderate impact weight-bearing activities like jogging are recommended in osteoporosis management for their ability to stimulate bone formation. Jogging on an incline further increases the mechanical load on the skeletal system, enhancing the osteogenic stimulus while remaining a safe and appropriate exercise for this patient. The spine remains in a relatively neutral or extended position during jogging, so there is no significant anterior vertebral compressive loading. This is an appropriate and beneficial exercise for this patient. Option 3. Bodyweight squats with the trunk in an upright position. Progressive resistance exercises targeting the lower extremities are a key component of osteoporosis management. Bodyweight squats performed with an upright trunk position maintain a neutral to extended spine, which minimizes anterior vertebral loading and makes this a safe and appropriate exercise for this patient. The qualifier upright trunk is doing a lot of work in this option, and recognizing its significance is what separates a careful reader from one who dismisses squats out of hand. Option 4. Sit-ups performed through a full range of spinal flexion. Sit-ups performed through a full range of spinal flexion create significant compressive stress on the anterior vertebral bodies, which are the most structurally compromised in vertebral osteoporosis. This exercise elevates the risk for a compression fracture and should be replaced with neutral spine core stabilization exercises such as planks. When we apply our biomechanical filter across all 4 options, 3 of them either load the spine in extension, maintain a neutral spine, or involve weight-bearing impact that is osteogenically beneficial. Only option 4 places the spine in full flexion under load, and in a patient with osteoporosis, that is the one exercise that must be avoided. The correct answer is option 4. Let's explore the all-student data. 55% of students selected option 4. Sit-ups performed through a full range of spinal flexion, the correct response. 25% of students selected option 2, jogging on a treadmill with a moderate incline. 15% of students selected option 1, prone press-ups performed through a full range of spinal extension. 5% of students selected option 3, bodyweight squats with the trunk in an upright position. This question is an other systems question which represents approximately 18% of all exam items. This question is an interventions question which represents approximately 26% of all exam items. This question is a level 2 question since the question requires students to integrate numerous pieces of information or to apply knowledge in a given clinical scenario. Remediation of level 2 questions occurs by increasing flexibility with academic content and by carefully analyzing decision-making processes when answering applied examination questions. Looking to review related academic content? Check out page 534 and pages 632 through 633 in PT Exam, the Complete Study Guide. Thanks for joining us on the Score Builders Q&A podcast. See you next week.